Quiero sin más esperar y agradeciéndote aquí tú, doctora, doctor conectado, recibir un colega tuyo, dermatólogo, el doctor Kwon Hyuck Hoon, desde Seúl, Corea, es dermatólogo, ha estudiado y se certificó en la Universidad Nacional de Seúl, es egresado de medicina también en la misma universidad, hizo labor de investigación en Harvard, por eso habla también inglés, es miembro de la Asociación Coreana de Dermatología, como lo saben, al igual que México, una de las sociedades y academias más renombradas y numerosas en el mundo de la dermatología mundial. Es miembro de esa sociedad coreana y de la sociedad coreana también de anti-envejecimiento. Es especialista en acné, rosácea, pigmentación, rejuvenecimiento y también hace muchísima dermatología cosmética y uso de láseres. Pero una de sus grandes características es que es también investigador. Ha hecho más de 40 publicaciones dermatológicas en revistas indexadas y no deja esa noche de presentarnos su último paper de exosomas justamente en cicatrices de acné. Y tendremos también después de él y unas preguntas y respuestas Richard Jean. Welcome Richard on board, que es director médico de Benev. Richard tiene 2 cachuchas. Estudió la bioquímica en Harvard en Boston y también después hizo medicina. Así que si te gusta estudiar largos años, pues el doctor Richard, más que tú aún, completó su investigación en áreas de enfermedades cardiovascular, hipertensión, toda la parte de reducción, oxidación, la parte de enzimas antioxidantes, biología plaquetaria, factores de crecimiento, así como wound healing, cicatrización de heridas. Actualmente funge, además de su práctica privada como director médico de Benev Company, impulsa la investigación y desarrollo para darle a los compuestos que vende, entre otros, Benev como exosomas, sus letras de nobleza a través de un respaldo, una casuística. Así que te agradezco a ti, doctora Cristina, que estás conectada, gran fiel de los exosomas, precursora en México, y todos los y las doctores que están conectados, la doctora Cintia, doctora Alma y todas las dermatólogas y sus colegas en ese momento conectados. Cirujanos plásticos, dermatólogos, médicos especialistas de la piel, bienvenidas en esa noche estelar. Y empezamos.
Hello, good evening, my friends in Mexico. I'm Dr. Kwon from Seoul, Korea. So I'm very honored to have the chance to have a presentation about exosome for my friends in Mexico. I have strong interest for culture and history of Mexico, and I like soccer. You know, Chicharito and Chisong Park are real friends in Manchester United, right? Yeah, it's very famous in Korea. So today I'm going to talk about exosomes, so application for cosmetic dermatologic indication and result of our clinical study. Now you see the screen?
Perfect,
right?
perfect.
Yeah,
Thank
perfect.
you very much.
Yeah. Yeah.
Thank you for being fan of soccer, of Chicharito. This is a great introduction. Un amigo de Chicharito y del jugador de Seúl en el Manchester, viendo México y Seúl. Thanks for being here.
So you remember the last World Cup, right?
Of course.
Yeah. So exosome regenerative complex, ERC is the American representative product of AS+. It's called AS+ from ExoBio, is widely used in Korea. So let me briefly introduce myself again. I'm Dr. Kwon. So before joining medical school, I have several experience of the research in biochemistry. Then after joining medical school, I became a dermatologist in Korea. I'm interested about various research in various fields of cosmetic dermatology. So if you have chance to visit Korea, please feel free to visit my clinic. My clinic is located in Seoul. So when I was in academia, I have several papers about acne. My main research field was acne, several papers about it. But after joining private clinic, I also interested about pigmentation, anti-aging, and pretty surgeries. So today's topic consists of 5 small subjects. The first one, I'm going to briefly review the 2 important biologic process and conventional treatment. Then at the second subject, I'm going to talk about why exosome is important at this stage. Then I'm going to talk about how we apply this product in clinical setting. Then let me show you some before and after pictures of our patients. And finally, let me briefly review our first clinical study of exosome for acne scar in humans. So let me start my first subject. Skin aging process consists of epidermal and dermal change according to intrinsic and extrinsic aging process. As all of you may know, epidermal thinning due to the abnormal differentiation process of keratinocyte was observed. But the most important layer for aging process is dermis. As all of you may know, quantitative and qualitative change of collagen, elastin, and mucopolysaccharides were observed in dermis. And all these kind of aging process may be attributed to decreased capability of senile fibroblast. You know, all the Audrey Hepburn, she did a lot of good work and contribution to mankind. However, if you focus on her skin, you will find that aging process of human skin proceeds very rapidly. So if you see this picture, paint every 10 years of the same person, you recognize that aging process of skin progress very, very rapidly. So again, skin aging can be classified based on layers. Dermal surface aging is the superficial layer, and subcutaneous muscle bone aging is deep area. But today I'm going to focus on dermal surface aging. It consists of decrease of elasticity, firmness, and it may create shallow crease and dryness. Fibroblasts normally produce collagen, elastin, and gags, which are critically related with dermal aging process. However, senile fibroblasts detach from collagen fibers just float on dermal microenvironment with decreased activities. And these lead to decreased concentration of dermal hyaluronic acid in aging skin. Again, aging process in skin progress very, very rapidly, even from the perspective of cosmetic dermatologist. The conventional treatment actually rely on device-based treatment for this kind of aging process. Many aging and resurfacing devices rely on designated wound recovery process for clinical efficacies. So wound recovery process after treatments are intricate and complicated cellular and biochemical courses directly involved with efficacy and safety. So if this patient visits your clinic for anti-aging purpose, I treat her with RF and radio frequency. And various radio frequency and HIFE devices have been tried for the aging process, but mechanisms of which are commonly related with steady recovery of intended dermal micro damages. Again, if this patient with acne scar visit my clinic, I treat him with some fractional lasers. The theory is the same. I stimulate his skin with laser and wait for some moment for spontaneous recovery. However, various stimuli from many devices sometimes have a limitation for efficacy to a rejuvenation with relatively late onset time. At this stage, Exosome is in. Advent of biostimulator and skin booster for anti-aging treatment in cosmetic dermatology is in the market. By supplying functional molecules, they can directly improve the microenvironment of a dermal layer. And these novel products usually consist of stem cell molecules, hyaluronic acid, nutrients, coenzyme, growth factors. These mixtures stimulate the functions of fibroblasts, leading to the production of collagen, elastin, and mucopolysaccharides. So basic concept is completely different with those of device-based treatment, direct supply of materials and fuels. So when a flower doesn't bloom, you fix the environment where it grows, not the flower. So with this same perspective and theory, PLP has received much attention in dermatology community, but accompanied with safety issues. Various stem cell-led products are booming in cosmetic dermatology market. However, they are having several drawbacks for the use of MSC, such as poor engraftment efficacy, potential tumor formation, and hardness of quality control. A lot of products and research papers about stem cells and stem cell-led materials. However, can dermatologists use them reproducibly and reliably at this time? That can be a tough question. At this time, exosome is in. Exosomes are membrane-bound extracellular vesicles with a size of 30 to 200 nanometer in diameter and released by fusion between multivascular bodies and plasma membrane. They are regarded as essential mediator of intercellular communication by transporting information and bioactivity between cells. So exosome actually provide novel insight for clinical medicine related with diagnostic and therapeutic fields. Especially stem cell exosomes are the key mediator of paracrine effects and can replace stem cells themselves. So they have essentially cell-free systems. Several studies have shown that MSC exosomes carry the property of MSC and are as potent as parent MSC in the repair and regeneration of various organ injuries. So compared with other stem cell products, exosomes have potential advantage by being safe, purity, mass production, sterilization, longer shelf life, and reliably effective. So this exosome is not just the subject of industry. They are very popular in academic perspective. So if you have strong interest about exosome, I strongly recommend you to read a review article in Science. So at this time, let me emphasize the difference between the isolate exosomes and conditioned media. Compared with conventional conditioned media, exosomes are highly purified. This company has a special intellectual property that separate exosome from other kinds of conditioned media. So the product without isolation and refinement process can be very dangerous. It can create toxicity, allergic reaction, and low activity. A lot of basic research papers have shown that these exosomes have very interesting and attractive property like hair promoting factors and anti-inflammation, and it can be used for the treatment of atopic dermatitis and skin barrier recovery. So this company has very interesting papers for the treatment of atopic dermatitis model with exosomes. So I recommend you to read these articles. Then what is in exosomes? Exosomes actually supply many anti-inflammatory and regenerative growth factors, including EGF, IGF-1, TGF-beta, FGF, and various mRNA and microRNAs. So this is the product AS Plus in Korea. This contains not only exosomes, but also hyaluronic acid, amino acid, growth factors, peptides, coenzymes, and other kinds of valuable mixtures. Then at the third subject, let me talk about how then we apply this product in clinical setting. You are all clinicians, so you may be interested from this part. So we have four major methods to deliver these important and valuable mixtures. The first one is mesotherapy, and the second, MTS. The third, fractional lasers or needle radio frequency, and the last one is ion-zyme treatment. So mesotherapy is a technique. I think all of you may be familiar with this kind of technique. It's an allopathic, intradermal, and local regional technique. So mesotherapy uses all injectable drugs as long as they're compatible with the intradermal route. And with the same perspective, exosome can be used with this kind of technique. So AS Plus injection can be reliably used for following indications. I think this kind of technique is strongly established from the intradermal filler injection in cosmetic dermatology. So you see this clip? Yeah, with some bleb formation like this, but it will disappear 1 or 2 days later. So it's very simple and direct. About more than 99% of these products can be effectively observed in dermis. However, injection is not officially approved yet in many countries. So dermal roller MTS is instead used for many countries. So it guarantees easy accessibility, low cost, and low downtime. So MTS makes temporary routes for this product to reach upper dermal areas. So it's kind of very simple. Just use this MTS for the effective delivery of this product, but the proportion of absorption may be lower than that of injection. The third one is fractional lasers or needle radiofrequency. These devices are very popular in Korea for the treatment of atrophic scar and rejuvenation. So apply them after laser treatment on the mask pack generally guarantees effective delivery and more refined and sophisticated methods compared with just MTS. So they trigger spontaneous wound recovery after inducing thermal, electrical, mechanical stimuli. And these devices temporarily form vertical channel bypassing epidermal skin barrier, and they allow the passage of high molecular weight particles. The last one is ion-zyme treatment. They are most non-invasive methods. So some patients really don't like any invasive treatment. Then for that kind of patients, you can use this ion-zyme treatment because exosome have some charge. So it's the most non-invasive delivery device for absorption, but efficacy of penetration is relatively lower compared with other device-based treatments. So you have multiple methods for the effective delivery of this valuable product. So let me show you before and after pictures. You may be interested about this part. So these patients actually treat with superficial intradermal injection with AS+, and you see the improvement of multiple indications. If patients visit your clinic, they generally have more than one indications. And for that kind of patients, this kind of product can be very effective because it can treat shallow crease and some enlarged pore and pigmentation altogether. And these patients with some darkness and some kind of dryness and some crease around her face were treated with 2 sessions of this product, and you see the remarkable improvement. Just 2 injections, and you see this kind of spontaneous improvement of multiple indications altogether. And these patients with some acne and some erythema and enlarged pores were treated with needle roller with this product, and you see the remarkable improvement of multiple indications. And these patients with refractory melasma, I think we share the similar skin type. In Korea and Mexico have skin type 3, 4, or 5, and we have refractory melasma around the periorbital area, very difficult to treat. And then if you combine pico laser and this product, you see the improvement and synergistic efficacy. And these patients with some erythema and enlarged pore and skin texture issues also treat with these exosomes, and you see the improvement of multiple indications. Yeah, the similar cases here. These patients also some darkness around the face and sometimes she has actually sensitive skin that suffer from everyday life, but treat with this product in combination with needle radiofrequency, and she was quite satisfied with the result. Yeah, these patients suffer from pimple, and you combine this product with pulse dye laser. So let me emphasize another advantage of this product is you can expect synergistic efficacy with use of this product with your product in your clinic, device in your clinic. So you can combine laser, with this product, you can combine RF with this product, and you can expect synergistic efficacy. And this product can not only use for cosmetic purposes and also can be used for dermatologic disease. This patient actually suffer from refractory atopic dermatitis and weary of topical application of steroids. And she was treated with iontophoresis with exosome without use of any steroid, and you see remarkable improvements. So I know that the company is trying to have some clinical study for atopic dermatitis and want to have good result in the future. So let me summarize my opinion for this product in clinical dermatology. Regenerative potential of this product was demonstrated for the treatment of shallow crease, pore dryness, and brightness. And it also has anti-inflammatory potentials, and you can combine your everyday device in your clinic for the treatment of multiple indications. You can expect synergistic efficacy for rejuvenation and scar improvement. Above all, most importantly, safety was confirmed in my last 1 year experience. Oh, 2 year experience from now. So we arrive at the final session. So let me talk about our clinical study. If you listen to my lecture at this time, you may ask like this: what makes this product special compared with other skin booster products? Then I may answer like this: this product contains exosomes. Then you may ask again: then the exosomes independently have regenerative and anti-inflammatory effect for humans clinically? That is the most essential question if you are a dermatologist. I'm also very curious about this material, so I myself evaluate clinical study of this exosome for acne scar model. So these exosomes are reported to have regenerative and anti-inflammatory effect for wound repair, but their clinical efficacy has rarely been evaluated yet. So we evaluate clinical efficacy and safety of this material as the secondary wound recovery enhancing agent after fractional application for acne scar treatment in this study. And this may be called the first human study of pure exosome in the world. So for functional evaluation of exosomes, we selected acne scar treatment model. And current and conventional mainstream treatment of acne scar consists of fractional lasers and needle radiofrequency in Korea. And combination of various non-ablative procedures may be the attractive means to satisfy both clinical outcomes and safety profile. We Asian skin and Latino skin also are very prone to PIH, so we are very eager to use this kind of non-ablative procedures, right? You may agree with my opinion, right? And I have papers for this kind of combination in 3 years ago. But still, clinical necessity for better efficacy and shortened downtime is needed for these procedures. So a 12-week prospective RCT that compared clinical aspect between two facial sites in same person, either receiving exosome or control for atopic scar after receiving fractional laser all around the face. And as you see in this picture, all patients were applied with exosome or control on each half side of face based on random assignment. So this is very rigorous and strict method that compares the exosome and control for their efficacy and safety. So we use highly purified exosome in this study. And we also prepare very highly required and sophisticated control solution. All ingredients are exactly same with exosome solution, except exosome in the real solution. And from now, you see the result of our study. Of course, because whole face covered by fractional laser, both half sides of the face show improvement after treatment. However, after second point time, you see the difference between exosome application side and control side. Very remarkable, because exosome in the basic research was shown to have clinical perspective. In addition to this quantitative data, investigators' global assessments was consistent with these findings. More patients received better grade for exosome side compared with control. And you see these pictures, right? Both sides experienced good result after treatment, but exosome application side was notably improved compared with control side. So we also apply 3D image analysis for scar, pore, and roughness improvement. And this kind of technology also inconsistent with our clinical evaluation. And safety was also very important in addition to efficacy. But we also checked pain, erythema, edema, and dryness after treatment. But notably, exosome application side was more safer compared with that of control application side. So it was very interesting because safety was very important in cosmetic dermatology, and Exosome was effective and safe altogether. So here we finally succeed in the publication in the prestigious journal Acta Dermatovenerology, summarizing all kinds of these findings. So the result of our study can be summarized as like this. We evaluate clinical efficacy and safety of Exosome as the secondary wound recovery enhancing agent after fractional application for scar in this study. So this is regarded as the first human study of pure Exosome in the world. So the journal summarized the result and significance of our research. The combined use of T stem cell exosomes with resurfacing devices could provide synergistic effect on the efficacy and safety of scar treatment altogether. So I am now preparing a book chapter from Springer Publishing Group for acne scar treatment, and I'm pretty much sure that Exosome will play more roles in the coming future. So this is my book chapter in Springer scar subject. So this is my last slide. Various stem cell biostimuli have been used in cosmetic dermatology. Among them, highly refined exosome-containing product, ERC, AS+, have provided satisfactory results with reliable safety profiles. And combination with conventional device also expect to provide impressive synergistic and practical results in various fields of dermatology. And our clinical study will provide more rigorous and strict data for Exosome soon in human. So again, congratulations for the launching and use of this innovative ERC in Mexico. Gracias. Thank you.
Dr. Kwon, thank you very much for your help. Muchísimas gracias por su ayuda. I will continue in Spanish for the translation. Gracias, Mariel, por la traducción.
Thank you so much, Mariel, for the translation.
Nos dicen muchos de los doctores conectados, perdón, nos dicen gracias. Thank you very much.
Many of the doctors are thanking us. There are some questions about the protocol.
There are some various questions, Dr. Kwon, regarding the protocol. The exact protocol of number of sessions you recommend for scar, acne scars. ¿Cuál es el protocolo recomendado?
What is a recommended protocol for acne scars? Numbers of sessions that you would recommend, and how much product?
And the number of sessions you recommend for those acne scars.
Acne scar, actually, I treat patients for every per week, and it depends on the severity and the state of patient's state. But usually I treat patients 3 to 5 times every 4 weeks.
Thank you very much. We congratulate Dra. Diana, Dra. Fanny Kramsky, Dr. Paco Castillo. Gracias por estar conectados. We thank you. Everybody's connected everywhere in the big country that you know, Mexico. We have a question from Dr. Lievana. How deep would you make the microneedling when you use microneedle device for acne scar treatment with Exosome? ¿En qué profundidad la micropunción en cicatrices?
How deep should you go when microneedling?
I usually prefer to use needle radio frequency instead of MTS, and the depth of MTS usually 1 millimeter to 2 millimeter, because to guarantee the effective absorption, you should use long needles instead of short one. So you may have pinpoint bleeding during procedure, but this kind of rather invasive treatment generally guarantees effective delivery of these kind of materials, because these are very large particles. So you should have more direct route for the effective absorption.
Great, thank you very much again. We say hello to Dr. Vasconcelos, to Dr. Hernandez, to Dr. Sandoval, so many people connected. We have another question about combination when you have at some point another concern, just like pigmentation concern, in addition to another concern that may be acne concern. Do exosome, because they have an array of action pretty vast, have an action of both or multiple uses, or do you do a treat concern by concern, step after step?
The reason why exosome can cover multiple indications is because they have two attractive characteristics. The first one is regeneration. The second one is anti-inflammation. You may agree that about 90% of the cosmetic dermatology treatment requires these two characteristics. So you can combine this product with your everyday practice device and you expect synergistic efficacy like acne and pigmentation and other kind of anti-aging purposes. So I think that is the real attractiveness of this product from the perspective of cosmetic dermatologist.
Great, thank you very much, Dr. Kwon. We have great experience, recent but great, with some dermatologists and other doctors in Mexico, and we will definitely share through Ethan and Excobio our Mexican experience with our special phototype, skin type of oily and thick skin, which is our characteristic in Latin America and Mexico, for instance. And we have a doctor mentioning, Dr. Avera, that in refractory melasma, in phototype 4, she has had incredible results combining exosome with other topical products. And this leads to our question from another doctor of, after the treatment with exosome, do you recommend any topical home care product?
Actually, the first question is melasma is still very difficult to treat. And I think our clinical study, maybe you may interest because we share the same skin type. We Korean also have skin type 3, 4, and 5. I think our Mexican friends have the similar phototypes. Melasma is very difficult to treat. I completely agree with your opinion, but nowadays Korean dermatologists think that more than pigmentation is in the melasma. So skin barrier enforcement and other kinds of anti-inflammation is required for the treatment of refractory melasma. And from that perspective, you can use this kind of product in addition to multiple lasers. And as far as I'm concerned, this company also has some kind of home care product. So I recommend my patients to use that kind of product after they finish their treatment. Cell tweet, do you use that kind of product in Mexico? It's widely used in Korea.
Actually, we need to check because I'm not pretty sure. Dr. Beatriz is asking another question, Dr. Kwon. Have you had some experience of combining or using exosome by Excobio Benev Auvergne product that is sold in Mexico in case of patient with ankylosing spondylitis or any other autoimmune syndrome? What do you recommend in those cases?
Yeah, as I told you from my slides for atopic dermatitis, this can be effectively used in medical issues in the future, but they are used off-label at this time. But sometimes they can be used for atopic dermatitis, but as far as I'm concerned, they are not officially used for that kind of difficult disease at this time. But in the future, I was told that the person in the company and other researchers are making some clinical research for that kind of refractory systemic disease, but not at this time officially.
Dr. Perez, stay tuned after with Dr. Jean, our medical director of Benev in the USA, also Korean doctor. He will answer part of those questions based on the research development from the laboratory. So you will get some answers in the next 20 minutes lecture. A last question for you, Dr. Kwon. This is a pretty recent treatment. How fast has it taken some reliance in your clinic, in your practice, among the different tools, products, and equipments you have? It means how fast do you think exosomes are making history, or is it a slow path movement that you're forcing in your clinic and among your colleagues in Korea, which is the home country for exosome?
And recently, this product is very famous in Korea because, as I told you in my presentation, they both have efficacy and safety from the perspective of cosmetic dermatologists. So they are very widely used in Korea beyond our expectation. So I think it may have the similar trends in your country because, as I told you repeatedly, we Korean and Latino in Mexico have similar skin types. So I think if you properly use this kind of product, I think it will become more popular soon.
Great. A great page of the history has to be written, and we will contribute in Mexico thanks to the collaboration between Benev, Excobio, who is manufacturing and doing the research from Korea, and our own Mexican doctors here with Auvergne and our authorized distributors. I think it's time to wish you a very pleasant day. We had a great time with you, Dr. Kwon, and I was very pleased to have you on board of Online Virtual Education by Auvergne. We will now hand on the microphone to Dr. Jean. Anything to conclude, Dr. Kwon?
Gracias. Hope to see you soon in Korea.
Thanks to you, and we wish to visit you in Seoul very soon once everything is back on track, definitely. Doy la bienvenida y hablo en español rápidamente para agradecer.
Now I will be giving the floor. Thank you, Excobio, the brand that represents Auvergne in Mexico. I want to welcome Dr. Richard Jean. He's the medical director of the company. He is a researcher as well. He studied in Harvard, in Boston, and in California, Irvine medicine, and his postgraduate studies. He is in charge of the scientific area. So without further ado, we'll give the floor to Dr. Jean after the great presentation of Dr. Kwon. He seems to be younger than his doctors, but he's a miracle of apoptosis and quality of the skin. So Dr. Jane, welcome.
Let's start with the scientific part and whatever you can add on top of the medical clinical presentation. Thanks, Richard, for being here with us.
Yeah, my pleasure. First of all, thank you for giving me the opportunity and the platform, the forum to speak. I love educating. I love helping other doctors, practitioners out there learn more about exosomes. And thank you for Dr. Kwon for giving a very, very thorough, eloquent talk on the clinical application of exosomes. I don't want to spend too much time, but I want to just talk briefly about kind of just the scientific aspect of exosomes. What are they? How are they made? Et cetera, et cetera. And I want to leave a lot of time for questions and answers. So by all means, if I go too quickly, that's okay. We'll have time at the end to answer questions. So next slide. Okay, so in terms of the Benev exosome regenerative complex, we've basically formed an exclusive partnership with Exosome. And you see on this slide here, there are only a handful of exosome, biotech companies in the world, with Exosome being one of the top 10 exosome companies. This is data going back to 2019, but fast forward 2021, and they've continued to grow. So you can see in terms of the publications and the amount of funding that they've been able to raise, they are one of the leaders in terms of exosome research. Next slide. All right, in terms of publications, right? So if we look back, going back 5 years, you rarely saw anything on exosomes. But if you go back more recently, 2, 3, 4 years, you just see the number of both scientific and clinical publications regarding exosomes is just starting to explode. And we can see that here. Next slide. Again, this right here, you know, in terms of discovery of stem cells exosomes, this is going back 2008. You saw there's a couple hundred publications, but now fast forward to 2021, we have well over 2,000 published articles within the literature. And now this is where it gets really exciting, because now people are starting to realize, wow, this is like the next generation in terms of wound healing, aesthetics, and, you know, people are getting really excited on how do I apply this to my practice. Next slide. So, you know, what are exosomes? And, you know, I apologize if a lot of you already understand what they are, right? They're basically small molecules. They range from 30 to 200 nanometers. So in essence, they are nanoparticles that are released by proliferating stem cells, right? And in the past, we used to think stem cells were the answer to everything. Stem cell this, stem cell that. But now what we realize is we don't actually want the stem cell. We want the exosome, right? Which are little nanoparticles that stem cells release. And we want what's inside of these little nanoparticles. And they contain growth factors, proteins, cytokines, microRNA, et cetera, et cetera. And these are the things that actually carry the message to other cells to help deliver the effect. Next slide. Again, here, this is just another slide regarding the biogenesis exosomes, right? What really makes exosomes unique is that these nanoparticles, they're composed of a lipid bilayer, right? And a lot of us have a basic science background or biology background. We know that typically the way proteins work is they travel to another cell and they bind to a cell surface receptor. Exosomes are different. Because of the bilipid layer membrane, they basically travel to another cell. They don't need to actually bind on a receptor, but they're engulfed and go into the cytoplasm directly. Next slide. Right, these are just different types of vesicles, because a lot of times people will talk about EVs, right, extracellular vesicles, and they can be broken up into exosomes, microvesicles, which are a little bit larger, and apoptotic bodies, which are just kind of metabolic waste products, but we want to focus on the exosomes. Next slide. Again, this is just looking at size, looking at microvesicles, looking at apoptotic bodies. This is, you know, EM looking at different sizes, but again, exosomes, they are nanoparticles that are naturally released by, you know, proliferating stem cells that contain all the therapeutic and regenerative effect that we're seeing in the clinical results that Dr. Kwon showed earlier. Next slide. Okay, again, and we talk about a big safety about like what are exosomes, how safe are they, Exocobio and Benev, like how much work have you done into it? Because a lot of people now, there's a lot of different companies out there that are trying to sell and market this, right? So this is just a glimpse in terms of showing the kind of the battery of tests, a number of tests that we do to, one, purify, characterize, and really show the functional capacity or capability of the exosomes, right? So if we look at electron microscopy, we look at Western blots looking at cell surface markers, or I mean markers positive with a positive correlation to exosomes, which are CD63, CD81, right? We do flow cytometry, and then in the bottom right, that's a dual fluorescence looking at exosomes in the cytoplasm of a fibroblast cell. Next slide. So again, you know, how many, aside from the growth factors, like how many growth factors, you know, this presentation here is a little dated, you know, showing that over 50 growth factors have been identified, but really now in 2021, we've been able to positively identify over 100 growth factors, right? And growth factors we're talking about, if I talk about EGF, FGF, you know, beta, VEGF, IGF, these are ones that really resonate with us, because up until this point, I know a lot of us are probably using some type of formulation or some type of topical that has purified or non-purified growth factors in them. The thing is, exosomes contain all of them and more. Next slide. So in addition to the growth factors, you know, the VEGF, FGF, and other growth factors, they have anti-inflammatory cytokines, right? meaning that not only are you, when you apply these exosomes topically or however you use it, not only are you stimulating from a growth factor level, but you're also decreasing the inflammation using a different mechanism. This is why, you know, I see it in the lab and I see it in my practice as well, because I treat a lot of patients as well using different modalities, including lasers and RF microneedling, right? Patients have substantially decreased downtime and the redness, and we talk about post-inflammatory hyperpigmentation, right? I think some of those are attributed to the anti-inflammatory properties that exosomes possess. Next slide. So what really makes, you know, how do you purify the exosomes? So one of the big questions is, where do you get the exosomes, and what makes it so special? The thing with Benev and ExoBio, basically, we have a patented technology. The source of the exosomes are adipose-derived mesenchymal stem cells that are grown in culture, and they go through a patented exopresso filtration process. It's a two-step filtration process that basically removes all large particles, removes metabolic waste, proteins, other components of the media, and in the end, you get a very pure, homogeneous population of exosomes. Next slide. This is just showing the facility in Korea. It's equivalent to a CGMP licensed facility. Next slide. Okay, so we talk about exosomes, and these are two different models of doing it. One is tangential flow filtration on the left, one is ultracentrifugation on the right. I have done both. In our lab, we actually have both mechanisms, and we compare side by side, taking the same adipose conditioned media, and we go TFF, and we also do ultracentrifugation, and we'll do them both, and we'll compare those in the end, and we compare purity, we compare quantity, and we compare functionality. And we've been able to show that through TFF, or the one on the left, you get more recovery, right? More consistent batch to batch, and then you get more effective removal of contaminants, meaning you get a more homogeneous population of exosomes, or more pure amount of exosomes. Next slide. Again, here, more recently, there have been some papers or some discussion or argument kind of about, oh, do you need to keep them in liquid? Do you have to freeze it? What's the best way of doing it? And, you know, we've actually done quite a few studies where we've been able to show that when you lyophilize exosomes, and what is lyophilization? It's basically taking something from a liquid form, making it into a powder, right? Same as like your Botox, right? When you get your Botox and you have your vials of Botox, it doesn't come liquid, but it comes little specks of powder. And basically, we're using that same technology to take liquid exosomes and make it into a powder, because one, the big thing is, you know, these have growth factors, it has proteins, it has cytokines. We want to preserve the stability, and we want to maximize the potency so that when we are about to use it on our patients, we can have the full effect rather than a decreased effect. Next slide. So again, this is just more data showing, particle concentration, particle size over time, looking at 0 months all the way up to 6 months. And we can show that when we lyophilize exosomes, you have very little change in the size, very little change in the particles in the size and the actual concentration of the cell. So it's very, very stable. Next slide. Preservation of the Bi-Lipid layer, right? Again, exosomes are comprised of Bi-Lipid layer, which allows it to traverse into another cell, bypassing a cell surface receptor, able to show that the Bi-Lipid layer, regardless of lyophilization, it doesn't affect it. Doesn't affect it in a negative way by any way, shape, or form. Next slide. So again, in summary, what do exosomes have, right? They have a ton of proteins, right? Again, to date, we have over 100 growth factors associated with it, but some are related to cell proliferation. Some are specifically related to wound healing. Some are related to anti-apoptosis. Some are related to anti-inflammation, skin barrier function, skin development, etc. Next slide. Okay. In addition to the cytokines and growth factors, we talked about microRNA, right, where we mentioned that, right? Basically, microRNA are, if you talk about the way proteins are made, typically it's DNA transcribed into RNA, translated into protein and having a downstream effect, right? But then there's this subset of RNA called microRNA. They're small, short, non-coded microRNA, and they typically exert their functions directly, but they usually have an inhibitory effect, right? Which means they typically downregulate gene function. And you can see with the microRNA that have been profiled in our exosomes, many are associated with anti-inflammation, anti-itching, right? Anti-aging, right? Thus, having a positive effect on proliferation and whitening in some areas as well. Next slide. This is a similar slide to what Dr. Kwon showed earlier, conditioned media versus purified exosomes. A lot of people use conditioned media, and it's great. It works really well, right? But when we talk about regular conditioned media to enrich conditioned media to purified exosomes, even within that regular conditioned media, it's the exosomes that have the regenerative, that positive effect, right? So now what we're doing is we're taking something that already works really well, but now we're concentrating it into purified exosomes. Next slide. Okay, now exosomes with respect to skin regeneration. Sorry, if I go a little too fast, I just want to be respectful of time. Basically, this is showing. All right, go ahead. Sorry, next slide. These are two different cell types: human keratinocytes and human dermal fibroblasts. Sorry, go back one. Or stay right there. So this is looking at two different types of in vitro analysis or cell culture studies, right? This is using a confocal microscopy. In blue on each of the slides, that's a nucleus of the cell. In green, that's exosomes labeled with green fluorescent protein. This shows after 24 hours of adding the exosomes to the cells, they're taken up into the cells. That's how quickly they start acting. Next slide. But I think more importantly, what does this really mean, right? So when we talk about the skin, our primary drivers are fibroblasts and keratinocytes, right? We've shown in vitro enhanced collagen synthesis, right? We've shown almost a dose-dependent response. When we add exosomes, we get more collagen, up to 6-fold increase in neocollagenesis. Next slide. And then elastin, same thing, dose-dependent increase, up to 3-fold increase or 300% increase in fibroblasts. Next slide. In terms of cell proliferation, you see that negative control with the growth supplement and then varying concentrations with exosomes, you see an increase in cell proliferation, dose-dependent response, which is not, this is very expected. Next slide. Or reepithelialization, right? Because this is what we care about a lot of times in our clinics, depending on how, what type of modalities we use, whether we use a laser, fractional laser, RF microneedling, we are disrupting the epithelium, right? So we want to see what happens when we add exosomes to it, and we see increased wound closure when we use exosomes in terms of reepithelialization of the skin. Next slide. Anti-inflammatory, right? And this may not pertain to all of us in terms of, this may be a little offshoot of it, but we can relate to this because any procedure that we perform, usually in our clinics, the result is we have an inflammatory response, right? So this is kind of a way to bridge and kind of explain why you have decreased redness, why you have decreased downtime. Next slide. Again, this is a study published in 2018. It's the world's first report on exosomes and atopic dermatitis. Basically showed that these exosomes, the same ones that we're using in the Benev exosome regenerative complex, same human adipose-derived mesenchymal stem cell exosomes are used in other applications, including atopic dermatitis, and shows that it decreases inflammation. Next slide. This gets a little more kind of nuts and bolts, but it improves dryness, decreases bleeding, it suppresses immune cell function, or that kind of, whenever you have inflammation, right, and you attack the skin, your body's going to naturally upregulate a lot of inflammatory markers. And what this has done in this model, the atopic dermatitis model, the topical application of exosomes has actually decreased it and calmed it down, and also increased the skin thickness. Next slide. So again, these are different factors: IL-4, IL-31, IL-23, more common like TNF alpha, right? These are directly associated with inflammation. So we're able to show that all these counts decrease with the application of exosomes in an atopic dermatitis model. Next slide. Okay, skin barrier reconstruction. Again, we'll just go next slide. I mean, the data speaks for itself. Basically shows that when you disrupt the skin, we want to look at a transepidermal water loss, right, and hydration. And we're able to show that in this mouse model, transepidermal water loss decreases when you add exosomes, meaning it's creating a barrier, right, to keep the skin hydrated and decrease the water loss across that barrier. Next slide. Again, and this is just a paper. So next slide. So, and then this is kind of where we're talking about the anti-aging and anti-inflammatory. So next slide. Again, you can use it in different types of applications, whether it's just regular microneedling, whether it's a roller, whether it's something more invasive like a fractional laser or RF microneedling, or something more ablative like an erbium or something like that. You can use it on all different modalities. Next slide. Again, the ERC complex comes in 2 vials. One has the lyophilized exosomes. The other has a diluent, right? And this diluent itself is hyaluronic acid based. It's beautiful because one, the exosomes are lyophilized, so it's preserved in terms of the activity. But then you open up the other one and you basically dilute or you reconstitute the lyophilized exosomes with an hyaluronic acid based solution that also has other peptides, actually other growth factors and other cofactors for oxidant stress, and it has a 2-year shelf life at 4 degrees. In terms of the stringent process of safety, right? All of the donor cells and material, it's been totally tested, right? You're looking at hepatitis, you're looking at HIV, you're looking at cytomegalovirus, Epstein-Barr virus. Then you're looking at other types of things like mycobacterium, right? You're looking at Neisseria, chlamydia, syphilis. It's all been tested to make sure that it's safe to use. Next slide. Again, just more things in terms of the quality control. Next slide. Again, and just different types of toxicity tests. Next slide. Yeah, and this is the, go back one real quick. So this is just a list of all the growth factors, peptides, enzymes, amino acids in that HA-based solution that you use as a diluent for your purified exosomes. Next slide. And again, these are just different modalities. The rest of my presentation was more on clinical things, but I think Dr. Kwon more than explained just the clinical efficacy with all of his trials that he's been running. So I'd like to conclude it there and open it up to questions and answers.
Thank you very much for your help, Dr. Jean. This is a very clear and very deep dive into exosome, and I'm very, very excited knowing that we're not only discovering everyday new uses, but we have the creativity of each doctor, especially in Mexico, who are making things happen with their own recipes and protocols and trial and error with this very safe product. We have Ethan Jean from the company from Benev and Dr. Jean connected. Everyone, if you want to make question, maybe Dr. Jean, you can tell us something to start with about those patients with autoimmune syndrome. In those times of immunity, of concerns about anything damaging and lowering our immune system, where do exosomes fit in, knowing that it is a pretty large array of uses and concerns that can be treated with exosome? Do you have any answers on this question?
Yes. So anytime you're looking at some type of, a person with an autoimmune condition, especially if they're on some type of therapy that helps keep it at bay, meaning lowering their immune response even more so, I think we always have to take into consideration the patient as a whole, right? We understand that they may be coming to us and say, oh, I don't like this, or I don't like this, I don't like these wrinkles, I need more volume, et cetera, et cetera, et cetera, right? So I think it's our duty as doctors and practitioners to take into consideration. In terms of the kind of the anti-inflammatory effect or the ability of the exosomes to decrease immune function, I think when used in the correct venue, right, meaning in a topical form, you're not going to affect something systemically. Meaning if someone does have like RA or something like that, right? So again, at least here in the States, it's meant to be used purely topically, right? It's not meant to be injected or any other types of uses that we do not condone. And typically when you do anything topically, it sits right there in that microenvironment. It doesn't actually go to a systemic level where it starts affecting other parts of the body. So I think when used appropriately with the right intent and conservatively, right, you can still get good results among a wide breadth of patients.
Great, thank you very much. We have Dr. Kramsky for a question maybe that was for your previous speaker about dermatitis, atopic dermatitis, active dermatitis, where the skin is much inflamed. There's a lot of inflammation on this patient. What is the correct use of exosome in this activated dermatitis?
Sorry, is that question towards Dr. Kwon?
It was, but maybe you can help us answer in those patients with active dermatitis where skin is much inflamed. What do you recommend in terms of application?
Right. So I mean, the study that we conducted with atopic dermatitis, we used varying modalities to treat it, right? But again, I think if you keep it topical, you're going to be safe, right? I think the modality that we actually used, I believe, was iontophoresis, where we helped increase the permeability of the actual the skin membrane itself, so that you have increased, I guess, absorption or efficacy of the exosomes. So again, with any of these types of conditions, because and this is the beauty of it, you know, like I'll be honest with you, like there are things that it's specific labeled for, and there's things that you can do kind of off label, right? And this is the beauty of our industry. Like we've been able to find different uses for like Botox, right? Like who knew you could use it for other things, right? Same thing with exosomes. So I think without being too specific, because I don't want to put anyone in a weird position, you know, I've used it off label for many other things. And, you know, for even atopic dermatitis, you know, if used conservatively, you could probably see a beneficial effect from that.
This is Ethan.
Thank you very
Benev.
much.
Hello, everyone.
Nice, a nice one. Ethan, there is another question for Dr. Jean before turning to you and speaking about the brand in Mexico. Anyone with experience, even if off-label, with psoriasis? This is a question from Dr. Martinez, Yolanda.
Yeah, so right now, I was gonna try to answer that right now in US with Dr. Jin and myself included. And when we are presenting information, right, we're very conservative in what we say, and we tend to be also absolutely careful in making claims. So as he says, there's a lot of studies that are being done from in vitro, in vivo, and then again, clinical trials. And then again, the psoriasis case is gonna be the first IRB that Exco and Benev is gonna partner together in US market, which we believe is going to take another 3 to 5 years from now on. So it's kind of long run and long road ahead of us. And then again, we've seen a lot of benefit to it, but I just know that Dr. Jin's not gonna, or Dr. Kwon for the matter, is gonna give you an answer that they want to hear from the clinical standpoint, because again, it becomes more like a very aggressive claim. So I do apologize for that matter, that I think that Dr. Kwon and Dr. Jin, they wanted to present their findings, you know, from the scientific perspective as well as clinical perspective, but obviously it'd be very difficult for them to making a claim. Obviously, this is a sponsor event from the company, and for that matter. So you know, that's the answer that I can kind of give you at this point on those specific questions on the medical.
Great. Of course, no need. We know, of course, that many of the drugs and treatments used in dermatology are even being employed off-label because the science, the technology, and the cost of clinical studies does not allow to go as fast as the creativity and the needs of patients through dermatologists try to implement in their clinic, you know. So we know that people are on their own judgment without any claim from the company, making their choices based on science. This is why we appreciate very much going deep into the anti-inflammatory, the components and the real effects and activity of exosomes so that people can choose based on that what's the best use of the product in their patient according to any disease or cosmetic alongside or first line treatment. This is definitely something. We have another question here. Once
so
the vial,
for that
yes,
question for psoriasis, Manu, if you can share the last published article that I shared with you, that
yes,
is specifically on the psoriasis related matters. That was small size clinical trials that we've done, that we actually published it. So I think that would be good, a publication that you can share with your doctor.
We will definitely share it, and I'm asking the team to show it right away. Another question from Dr. Alejandra about the vial itself. Once you reconstitute the vial, how long can we keep it in, and in which conditions?
Dr. Jin, you want to answer that? It's
Yeah,
okay
so-
to certain long, but not so long. But Dr. Jin
Yeah.
can explain from experience.
For me, the way I look at it is, you know, when you reconstitute a vial of Botox, right? How long do you want it to sit before you use it, right? We know that Botox, you can keep it at 4 degrees for a couple of weeks and it still has potency, but it does decrease, right? So for me, what's really convenient about the ERC complex is it doesn't come in like a huge volume, right? It really comes in a very small volume, right? It's a couple cc's where it's perfect when you reconstitute the actual exosomes, and then to be able to use that in one application. So I rarely, if ever, find myself having to store it. And I know this is a very common question, but the way Benev has packaged it, it's meant to be a single use kind of one and done. But let's say if you do have a little bit left over, I think keeping it at 4 degrees Celsius for, you know, upwards of a week or so, I don't think you'd see that big of a downturn in terms of efficacy. But for me personally, when I'm talking about this and educating my patients about this, and I've sold them on it and they really want it and they're willing to pay a premium on it, I don't want to take the risk of using something that's not working at 100%, because then my results may be compromised and thus my patients may not be happy. But then again, you know, the volume that the actual ERC complexes are prepackaged, it makes it really nice and very easy to reconstitute it and really do, you know, have coverage for like the full face.
Very clear. Thanks for the answer. I think we covered a lot of topics tonight. I think this is something we want to do on a regular basis. We're showing different prospective studies that we got from you, Ethan. This one is on skin brightening. We have others on psoriasis with a small group. All those are available to you, doctor, asking to your commercial advisor and your sales force from Auvergne and its authorized distributors along Mexico. So without any doubt, doctors, you are entitled to get those studies about how combining exosome with fractional laser in scar of acne. This is something we covered with Dr. Kwon at first. We have those studies are prospective, investigative, because this is part of the science. It starts with little prospective studies by individuals and it ends up in multi-center clinical studies. This is a long story that's just being started with exosome, and we, without any doubt, Mexico wants to be part of it. And thanks to Benev and Excobio representative in Mexico through Auvernia, we will make it happen. Many doctors are asking for more data. No dejen de pedir a su distribuidor autorizado.
Please ask your authorized distributors, your commercial advisors from Auvernia, and they will share that with your local contacts.
To tell you, doctors, and thank you again, Dr. Jean, Dr. Kwon, and Mr. Jean Ethan for being with us tonight. We thank from the heart the great effort, and this is not the last time. We will definitely have this on a regular basis to bring new clinical data, new Korean experience with other doctors, thanks to Excobio collaboration with Benev and Auvernia. Let's make things happen again in the future, Ethan.
Yes, again, thank you so much for Vania for putting this event together. And then again, obviously, we would like to do this as often as possible. And then again, hopefully, if things get better with the COVID situations, that we can fly out. You're our neighbor, right? To see you guys and meet face to face. And I hope that the day will come pretty short. And we're kind of excited about, getting together again and discuss about this great opportunity. And then again, share our experience together.
Well, we thank all the dermatologist doctors that got connected today. We're still more than almost 50 people. We record that Dr. Kwon and Dr. Jean are totally available through Auvernia for any question, another deeper thoughts or a questioning about the brand, about the products, about any clinical study. We have with our general manager here the great pleasure to organize this together, but also with our medical manager, Dr. Joana Guerrero Santos, who is an expert at the product. Any concern you have in Spanish, please feel free to ask your sales representative or directly us. We will be glad to provide you any data or information if we're able to give so. If not, let's create our own reality. Gracias. Fue la plática de Exosome. Don't go away. We're just
you.
showing the program of next week because we are a company diverse y les enseñamos a todos el programa de la semana que entra. Agradecemos a Mariel para la traducción del día de hoy. A Carlos.
Thank you so much for the translation, Mariel. Thank you, Carlos. Next week, from Arizona with Dr. Vivian Bucay, Mexican dermatologist that lives in the United States with PCA skin, peeling for sensitive skin. We also have Miriam Tamil Hayet from France, the research director for SVR for the launch of the new Sun Secure Sun Protection with Ocean Respect, new formulations, 100% not tested on animals. 360 degrees of photo protection and safety for the environment and for humans. And on Thursday 28th, we have the launch of the new Time Filler Serum with Lisbeth and Clementine, our marketing director and training director. That will be in week 20. We are in Auvernia official, and this was the latest transmission from a great friend, a colleague that today leaves the company because he's going to other parts of the world of engineering. Carlos Pechir, thank you so much. I want to thank you for your great contribution to this program. We keep Auvernia, we'll keep going. Without Carlos, we will miss you, of course. And we wish you the best in the future. Thank you so much for everything you have done. Today's transmission in the YouTube channel, very soon, Auvernia Official, in Facebook, Instagram, and our official channel in YouTube. All of the transmissions always available for you, doctors. And Mariel Marcela translating. Now let's get to work. Let's make people happy after their acne or simply to improve their appearance with exosomes. And all of the products and services that we have in Auvernia Group. It's a pleasure having been with you. Take care, everyone.
Richard, sorry, thanks, Ethan. That was a great moment altogether. And
you.
see you very soon in another program of OBE with the Exosome by Benev. Gracias a todos. Nos vemos semana que entra, el día lunes, para el tema de peelings. Buenas noches, a cuidarnos en esa semana 19. Hasta luego.